A few years ago, we had a very big problem in multiple myeloma field. We had a problem in triple class refractory patients. Locomotion and mammoth studies showed very bad results with overall survival less than 1 year. And then BCMA-directed therapies revolution this field. Now we have CAR T-cell and biospecific antibodies with a deep and durable response, even in patients in relapse and refractory. So we have one solution. But what's the problem? We have patients that respond very good to these therapies, and we have other patients that do not respond. So we think that it's very important to know why one patient is going to respond and why another patient is not going to respond. So we want to design strategies to see why one patient is going to respond and another not. One of these strategies is biomarkers. One of these biomarkers is soluble BCMA. So we designed one prospective study in which we included 160 patients. From these 160 patients that we included between 2022 and 2025, we selected 36. 20 with CAR T-cells and 16 with biospecific antibodies. We selected these patients because we monitorized soluble BCMA in different moments. From baseline initiation, day 28, 56, 100, 6 months, 12 months, and progression. We our objectives were mainly three. The first one, to correlation soluble BCMA with tumor burden markers. The second one, to study if soluble BCMA can be a dynamic biomarkers. And the third one is if soluble BCMA can predict early response. Baseline characteristics were similar in both groups, and regarding with the results, the first questions to correlation soluble BCMA with tumor burden markers. Well, we saw a moderate correlation between bone marrow plasma cell infiltrations and also with a monoclonal serum protein. About the second question, about a dynamic biomarkers, we saw that soluble BCMA in patients that achieve response have a big decrease by month 1, and this decrease maintains stable in patients that achieve response. Patients that does not achieve response have levels that were a little bit higher. And when a patient is going to relapse, we saw that soluble BCMA levels increase. We compared in both groups, in CAR T cells and biospecific antibodies, and we see similar results. Maybe in CAR T cell groups, the response were deeper and quicker by month 1. And regarding the third questions, if soluble BCMA can predict an early response, we saw that patients that achieve at least partial response by month 1 decrease soluble BCMA levels around 40 points, but patients that not achieve response, we have a very big increase of soluble BCMA levels. So we can conclude with this study that soluble BCMA is a serum biomarker, and that correlates with tumor burden markers, that can be a dynamic biomarker and also can predict patients that respond. So we think that soluble BCMA, although further studies are needed, we think we can, this strategy, we can go through a clinical routine.